But this particular person I'm going to share he has been in and out of mental health services for a long time. And I think what we do wrong in mental health services, we are always looking at the symptoms, we are looking at the behavior, and we are trying to fix behavior. And he had a diagnosis of schizophrenia, and he had lots and lots of risk history because he took action based on his paranoid thinking, his delusional thinking. And he'd been in my unit since January this year, and he came to every single group, and we also had one-to-one sessions. And how he shifted. It was not like, oh, he doesn't think paranoid thoughts anymore. He had this testimonial from his mother, his own testimonial. There's no trace of schizophrenia at the moment. He's also off medication. He seems a very different person. And when he speaks, I almost like, oh, I wish I could explain just the way you explain it. Because some people are very natural and they just say it. And he has left my unit now. But I'm saying, blimey, can this really happen? You have a diagnosis of schizophrenia. I've gone through his notes. Yeah, every symptom he had fulfills the ICD-10 criteria, DSM-5 criteria for paranoid schizophrenia. And I haven't done anything different. I mean, he has had we have tried all sorts of medication. We have tried psychology traditionally. And yet he's saying that this understanding is somehow grounding him. And I don't think it's anything necessarily I said, but something he saw himself. And he and I are now still having conversations over Skype. And he wants to share with the rest of the people about what he has learned. So I hope there's a book coming up or something. But he says, Rani, there are people who are against NA or AA. You guys know about Narcotics Anonymous or Alcoholic Anonymous. And he had addiction problem in the past as well. He said, maybe this understanding might be helpful for them. Because people worry about handing over power to something else other than you and God and sort of thing. In that sense, but he felt that this understanding might really help people with addictions. And so when I think about him, I mean, for the first time when he left my unit, I really felt very, almost like sadness of some kind, but at the same time very freeing. I knew it was freedom for him. And I hugged him. There's something about therapeutic relationship, what doctors are not supposed to be doing. And he was my patient, I'm his psychiatrist. But after the end of the review, I couldn't stop myself. I gave him a hug. And his mother hugged me and so on. But that's the beginning of his journey. And I love stories like that because it just tells you something like, hang on. He had medication for a long time, all sorts of medication we could think about. All the medications gave to him were side effects. And he said, Rani, when I committed what I committed, I was still taking medications. The medications didn't stop me from acting out. But if I knew then what I knew now, I wouldn't have done that. And can you see his wisdom? So I know that he might fall asleep, he might forget it from time to time, he might get caught up in his thinking, just like I do, just like we all do. But it will be impossible for him to go back to where he was, because that's where I am myself. And thinking about well-being and thinking about psychiatry, and I know psychiatry and mental health has got a lot of negative press about, oh, we are biological and we try to pump medications into people, and there's a truth to that. There is a truth to that. But can you see how we are just abiding by the guidelines? That's been my schooling. That's what I've been taught in a college. And I have seen people really do well in medication as well. So it's not, but medication, we all know medication is not the answer. It could be a tool. And psychiatrists and mental health professions, we have that medication in a toolkit. Doctors have that in a toolkit. And can you see that from time to time, I mean, if it's physical health, we know that if you have a broken bone, you of course have to get it fixed, right? You can't just say, I know the three principles, so maybe it'll heal it. You could do that, I guess. I'm not saying anything about it according to people's belief. But I guess it will be okay to get it fixed, right? To go to the orthopedician and make sure you're walking properly. And I think there's a role for tools and techniques. Don't get me wrong. EFT has helped me immensely. And I think that's one tool and technique I still believe in. But what has shifted for me is that I don't need to keep doing it. I don't need to keep doing the tool. But even more, the other thing is that why I struggle with tools at the moment where I am, and this is personal, okay, and it might not be true for everyone, is that I no longer believe that we need to go back to the past to heal. For me, that's really not needed. That we need to go back and look for answers as to, I had this and this and this and abuse and so on. So let's look in the past and see how I can make sense of it. And part of psychiatry is that, part of psychology is that. And I'm not saying that you can, we'll go out and say, hey, stop doing what you're doing and do it now. I think it will come. It's just about being patient. But I realize now that, yeah, of course I'll listen to people. Of course I will listen to what they have to say about their past. And I will connect to them and their pain. But from where I am now, I know that's not who they are. I know that they don't have to keep going back to the past. If they want to, fine. But that's not where they will find a peace of mind or whatever they're looking for. And that's been radical for me. That's been a huge thing for me. Because as a psychiatrist, I used to say, if people are saying, no, thank you, I don't want CBT or something else, denial. How can you get better without therapy? And you say, well, NICE guidelines says this. You need to go for this, and medication is not the answer, so CBT or some other form of therapy. And I no longer believe this is necessary. Yes, people might want to, and that's fine. And if people want to say, Rani, this is very traumatic for me, can I talk to you through this? Can we use EFT? Of course, I'll help them if this is what they want. But I'll also point them to the truth. Because I don't have any patient, no matter where they are and how long they have been unwell. When I see them, I just know there's more to them that they see for themselves. That maybe my other nurses or colleagues seeing them. I just know. And sometimes I feel frustrated, like, oh damn, I can't see you. Why can you not see it? I'm trying everything. I'm throwing away this sin and I'm throwing away this rehabilitation activities, and then why can't you see it? And can you see how much because I want the best for my patients, I'm trying to give them insight. Look, this is my insight. You get your insight from me. And that's not how it works. People will wake up when they need to wake up. And like Ian said, all we can do is offer them the opportunity, which I am offering. So one of my private patients, again, she came to me, and she with psychosis, she didn't want to take any medication. And the place she is so different. Even her husband can't believe the changes in her. And she uses this analogy to explain how she feels about it. She says, it's almost like before, when any thought came her way, she made everything out of that, okay? She would put all sorts of spice and act on it. And she was, what I would say, psychosis, in using a jargon the psychiatrists would know, or health professionals would know. And now, because she's been introduced to this understanding, she realizes these are almost like, some people would call it clouds, or, she called it almost like puffs. And she would say she just like it, and after some time it goes away. And she said all her life, sometimes she's trying to do go away. And guess what? The harder she tries, it doesn't shift or it comes back. And she realizes she doesn't even need to do anymore. She doesn't need to do anything with her thinking, trusting trusting that there is something else going on that she could just be okay with. And whatever that is guiding her. So beautiful, beautiful insights people are having.